Yeah, and here's the thing, right? When it doesn't go right, or it's not that it doesn't go right, when a curveball's sort of thrown in
Mm.
there, do you have the ability to stay calm, think coherently, reflect back to when your boss was screaming at you 20 years ago, blah, blah, blah? Are you that person that can do that? Because because that's a
Mm.
strong skill that you've got to have in a moment of absolute shit.
Mm.
What am I going to do? You have to do something.
Yeah.
But,
Yeah.
and actually, it's a resilience thing as well, isn't it? We all talk about resilience these days, and training resilience and ensuring that we're all resilient. Yeah, I don't know. I like that space. I exist in that space. A lot of my day is in that. What are we going to do here? I'm not talking about just generally surgery. I'm talking about COVID hit. Everybody, all the management left the hospital, and 2 billion people turned up at the hospital doors with a disease that we didn't know much about, but apparently it was going to kill everybody. What do you do then? So there's the whole management side of
Mm.
my job as well as the surgical skills. So I kind of love being a surgeon, if I'm honest.
Have you sought help for this dopamine addiction of yours?
I don't, I know. I'll tell you what it is. It's called a pint at the end of the day. But I'm probably not allowed to say that anymore. We always used to just, I tell you what, we used to just go for it. We used to go for a pint after work, right? And the boss would be there by the first round, and he would turn around and he would say, "You did well today," and just give you honest feedback.
Yes.
Say, you know
Yes.
what? Actually, it was a bad day today. You didn't do great. This is what you should do. And it was just talked about over a pint, and it was not viewed as anything aggressive. It was just a
Do
sort of
you
way to feedback and debrief and de-stress and work out, am I on the right trajectory? Yes or no? We just don't do that anymore.
you don't?